All right. Good morning and welcome to another morning episode of the Liberty Dad podcast, a discussion on politics and culture. If you're tuning in live, thank you so much for giving me your time so early. Do me a favor, folks. If you enjoy this show, or if you don't, be sure to like and subscribe to my channel. And then for the really serious folks out there, you know who you are. Hit that bell so that you never miss an episode. All right. Today, we're titled Medical Errors in COVID Lessons in Hubris. Like, what does this mean? What are we talking about here? Well, so here's what happened on social media. Like a lot of things, social media drives a lot of the content that I make here. So on social media, I had an interaction. Here is that interaction, and we'll take a look at it here real quick. So this Dr. Spencer Nadolsky said, I can't believe people fall for this crap. So frustrating. But I guess that's how fear mongering works. And they were quote tweeting somebody that was like, this is Kaylee and Casey Means. The siblings exposed the dark truths behind Big Pharma. And it was a little bit longer post, basically saying like, there's a conspiracy theory that we're going to, tell you about that you don't know about. So this doctor was like, really? Fear mongering? Come on. And so I chimed in because, that's what you do on social media. And I said, good point. And I quoted him how the medical system really works. And then I said, is a misnomer given medical errors being the third largest cause of death. Works is an overstatement. Now, I was being a bit punchy or snarky or whatever, like that's how I am sometimes. And so then somebody else chimed in is Andrea C. Love, PhD. She's, I believe, an immunologist. And I checked her out. She seems to be legit. So this is not like some fake account. She said, oh, you're repeating Marty McCary's lie. I don't know who Marty McCary is. So whatever. So then I responded, I said, the response any reasonable person ought accept is, oh, hey, common misconception. I get it. This was published in media and in journals for years. Check out this critique of that info. But no, instead, we get the intellectually rigorous, nah, that dude is lying. And then she responded and she said, considering it's been debunked dozens of times and he continues to circulate it for his own profit, nah, I don't need to be patient about correcting it. So I left it with this. Then you engaged for naught, and whatever credentials you believe are worth my attention mean nothing. I might as well be arguing with a fifth grader. They can say people are lying too. Nice to know doctors waste patients' time at the office and on the internet. Now, I technically misspoke there. I'm not a patient of hers, but the point that I was making was, you know, have you been to the doctor and had to wait like 30 minutes, even up to an hour, maybe even longer for the appointment? You show up, the doctor's like, all right, your appointment's at 3:30. You show up at 3:30 and like 4:30, you get to roll in there and then they're kind of like rushing through. And you're like, hey, I was on time, you know? So like, that's what I mean by wasting patients' time at the office. If I spend the effort to show up on time, maybe you should too. Right. And if you can't, figure it out. Right? Like, I mean, if I show up an hour late, what are you going to say? Sorry, can't take you in today. You missed the window of opportunity. But my time isn't valuable, right? Do no harm. How about to my time or my wallet? Anyway, that's a conversation for another day. But that's what I was getting at. And then I was like, all right, well, you wasted my time because you wanted to call me out and on the internet and say, oh, you're repeating this dude's lie, some dude that I didn't even know. And then you don't even want to like point out what you're talking about. Like, okay, well, I mean, if that's where we are, then fine. Now, unlike many people, I was actually kind of curious because I was like, well, what is he talking about? Who is this Marty McCary? Is that his name? Marty McCary. I was like, who is this? I don't know. And I was curious because as a podcaster, well, for me specifically, I like to be right. I talked about this yesterday on my show that I am a commentator. I comment on politics and culture, and I like to be right. I don't want to I don't want you to tune in, listen to my show, and then I egregiously have all the facts wrong. Now, from time to time, I will get some things wrong. That's just part of the nature of it, right? I'll seek out some information and maybe I didn't see something, or maybe I was being a little sloppy that day, whatever the case. So I'm not always going to get things right, but I like to be right. And I work really, really hard to be right. So I was kind of curious. I was like, this is interesting. What's going on here? But I want you to consider something. I want you to consider this 2014 clip from Politics and Prose. Now, I want you to think about what she just said to me. She's like, "Oh, you're repeating this dude's lie." Okay. So we got one dude that's spreading this lie and everybody's just gobbling it up. All of us dumb patients, all of us non-PhD having people, non-experts. We're just gobbling it up because we're dumb. We're just repeating lies, right? That's what's going on here. So here's a 2014 clip from Politics and Prose, and it's of Dr. Leanna Wen. Now, you don't give me a hard time, folks, but you might recognize her as the crazy tyrant who got on television all through COVID and was supporting lockdowns, like harsher lockdowns than many places were even implementing. She was like, carrot stick. People need to realize that they can have their freedoms if they do what we want. Like, she literally said that. Okay. But let's get away from her. When it comes to public policy, I think she should sit down and be quiet. But I think she has something to say when it comes to actual medical care. And so she wrote this book called When Doctors Don't Listen years ago. And she was at a library doing a talk on it. And this is where Politics and Prose comes in. And so here is a clip of that video, and you can find the whole, and actually the whole video, the link to it is in the show notes. I actually would encourage you, even if you can't stand the woman on her policy prescription for COVID, I would recommend that you go watch this video. It's very interesting. Check it out. But for now, we'll just do this little clip. So here's this.
In 1999, there was a study done by the Institute of Medicine that showed that 100,000 people die from medical error every year. And the more recent study found that that number is probably an underestimate, that number is probably closer to 250,000 people.
Okay, so let's stop right here. She's got all the bona fides. Okay, so she is a legit doctor. She has, done a lot of, she did ER work. She's done some other things. I'm not going to go and list all her accolades, but she is a legit doctor. And she's talking about now 2 different studies, one in 1999 and 1 year later. And she said, like, these 2 studies kind of bring us to the point where, hey, 250,000 people die every year from medical errors. Okay, 2 different studies. So let's continue on.
Who die from medical error every year. The number 1 cause of fatal medical error is misdiagnosis, which makes sense, right? Because if your diagnosis is wrong, then probably so is everything else that follows.
Okay. Raise your hand if you've ever been misdiagnosed. Hey, right here. I'm not trying to grab her. That'd be weird. But anyway, yeah, a lot of, if you haven't been, you surely know somebody that's been misdiagnosed. It's very common.
Now, one of the problems that contributes to it is lack of time. In our medical system, doctors are not reimbursed to spend time with patients. We're reimbursed to do things to patients. A procedure, a test, all of these things are pay, but time spent with someone to figure out their history is not what's actually going to pay at the end of the day. And when you go see your doctor, and the doctor says to you, Mrs. Jones, how are you? What brings you to see me today? How much time do you have before the doctor interrupts you? According to a study done about 15 years ago, that number was 18 seconds. In a more recent study, actually is closer to your guess. It's 10 to 12 seconds. How much can you get across in 10 seconds? Let me ask you to guess another number. What percentage of diagnoses can be made just based on the story, just based on your story of why you came in? What percentage? Do you think 50, 60, 10? So studies done in the 50s, the 60s, in the 70s, all the way until present day show that that number is 80%. 80%. And that number has not changed despite us having more technology. So what that means is 80% of your diagnosis, I think it's really remarkable, 80% of diagnoses can be made just based on your story. That's better than your physical exam, better than any test, better than any combination of tests out there. But if doctors are interrupting you in 10 seconds and that number is decreasing, then what are we doing in terms of actually connecting with people, in terms of actually listening and figuring out what it is that patients have?
Okay. So we've all had this experience. You go into the doctor. I mean, Joe Hanush here says, doctor spent 30 seconds with me, misdiagnosed, charged $600. This is like insanely common. I could probably right now go out to a busy street and just randomly grab like 20 people and then ask them if they have a story just like that. And I would be willing to bet that over half of them would have a story and the rest would know somebody who had a story. But I would be willing to bet that not a single person will be like, it's never happened to me and it's never happened to anybody I know. I seriously doubt that would happen. Now, it may not be $600. It could be like, a regular office visit, or it could be like, hey, I had to go through several, visits or whatever. But it's going to be, I got a misdiagnosis and it cost me time or money, right? One of those two. This happens all the time. And I'm not trying to beat up on the medical community. Okay. Not quite. We're just trying to try to lay this out, because remember, this all originated from a doctor who did not want to correct me and say, hey, here's some information that might change your mind. Here is what you need to know. Instead, she was just like, nah, it's been debunked. You figured out. Okay, well, I'm not really sure. Was she telling me to do my own research or not? I don't really know. I can't, like, we're told not to do our own research. Okay, great. And so then what do? We rely on just what? The random internet doctor that I run across to tell me what I need to know? Or how about headlines? How about mainstream outlets? Well, let's take a look, because I've got some headlines that I dug up here that I think are kind of interesting. So here we go. This one is from the WR. This is the first one that came up. So it's not quite a mainstream, but WRTV. A father shares his mission to teach the tragic outcomes medical errors have. Medical errors are to blame for as many as 251,000 deaths annually in the United States, according to, and then it cites some other paper or something. Look, August of 2024. Okay, awesome. Next one, CNBC. Okay, we're getting a little warmer on the mainstream. Third leading cause of death in the US, most doctors don't want you to know about. That's a little cheesy. Most doctors. It's like, that one trick the experts don't want you to know. That's definitely clickbaity. Um, let's see, number 3, John Hopkins University. Call me crazy, but John Hopkins, that's not some run of the mill. That isn't the bro that's got a blog that's just running his mouth and doesn't know what he's talking about. This is an esteemed university. John Hopkins study suggests medical errors are third leading cause of death in the United States, 2016. NPR. Now, I know a lot of my Liberty fam will be like, NPR, like whatever. It's like NPR is actually a pretty decent, like when you read their news stories, they're actually pretty decent. And they are relatively mainstream. Okay. So medical errors are the number 3 cause of US death, researchers say, also 2016. A lot of these are going to be 2016. Washington Post, another mainstream outlet. Researchers, medical errors now leading cause of death in the United States. Are you noticing something here? And this was just by happenstance. None of these are right-wing outlets. Just throwing that out there. Okay. They're not right-wing outlets. This is not Joe Rogan outlets. I know everybody likes to give Joe Rogan a hard time. Like, I can't believe he asked that question. Well, how dare he? Let's see. What do we got here? Time Magazine, medical errors are the third leading cause of death study, right? And then it says heart disease, then cancer are the leading causes of death for American chronic lower respiratory diseases like bronchitis and emphysema. And then I think it goes on to say are trailing, somewhere behind, but not the third. All right. Let's see. Stat News. Have you ever been to Stat News? I have. I've read a lot of stuff from Stat News, and I think they're pretty reputable as far as I know. Medical errors, third leading cause of death in the United States, 2016. Let's see. PBS, another, these are, again, mainstream, not right-wing outlets. Is fatal medical error a leading cause of death? All right, question mark. The CDC does not list medical error as a cause of death in its annual mortality statistics, but according to researchers from, and then they go on to say Johns Hopkins, they're citing John Hopkins. Okay. Medical error. This is the Guardian. Medical error is the third biggest cause of death in the United States, experts say. Okay. Weasel language there with that experts say. Vox. Okay. Again, Vox is definitely not right wing. Study. Medical errors are the third biggest cause of death in America. Okay. And they cite this 250,000 fatalities in 2013 alone. This is written in 2016. And the last article we got here, healthcare innovation. John Hopkins research finds medical errors third leading cause of death in the United States. So this idea was common. When I cite this, I'm citing like all of these mainstream outlets, some of them esteemed, some of them depending on, your political flavor, right? If you're if you're more right wing, you probably aren't going to be looking at the Washington Post as an esteemed outlet. But if you're more left wing, you probably, or more progressive, you probably will. Right. So these are definitely not right wing. So you can't blame it on, oh, it's just a bunch of right wing Fox News nut jobs. Nope, can't do that. These are mainstream outlets that everyday Americans get their information from. And they perpetuated this. This is where I got the information. I've read this many times. So I'm like, all right, if all these outlets are reporting this, and there are some right-wing ones out there too. They didn't happen to pop up in my feed for whatever or when I did the search. But like if the right wing, the left wing, medical establishments, if they're all saying this, yeah, I'm going to believe it. Yeah. And it makes sense because it matches many people's experiences, mine included. In fact, I'll tell you a little story. I don't know how it happened, but somewhere along the line, I had a tiny little hole in my head, like two of them actually, one on either side, right above my vestibular system, my inner ear. There was a tiny little hole between my inner ear and my brain, a tiny, tiny little hole, like maybe like a millimeter or something like that. And I stumbled upon this weird array of symptoms. And I was like, when I was just reading whatever, and I was like, that's weird because I have that. And so I started digging in a little further and I was like, oh my God. I was like, I think I have this rare inner ear disorder. And the big telltale for me was that I could literally hear my eye move in my head. Like when I move my eyes, I could hear it in my ear, my right ear. And they creep people out. Like, you can hear your eye move? Like, yes. Like when I move, I can hear it. And if you want to know what it sounded like, put on a set of headphones like this, don't have any music playing, and then just rub the cord. And that sound that you hear, that's about what I would hear when I would move my eye. And I had that forever. So I went to the doctor. I went to a regular doctor. I said, I can hear my eye move in my head. And I think there may be some other issues correlated with this. And he basically dismissed me and just told me to turn the radio up because I told him it was distracting. And he was like, just turn the radio up. And I'm like, okay. So that wasn't a good answer. And so then I think somewhere along the line, I came across uh, a doctor. So I did come across a doctor that said, I don't think you have it, but you have a weird constellation of symptoms. So I'm going to send you to get a CT scan. So then I got the CT scan. So then he comes back and he goes, I don't see it, but the radiologist does. So I'm going to defer to the radiologist. So now I'm going to refer you to this inner ear specialist. So now I'm like, all right, the radiologist has confirmed this. And so then and this other doctor is deferring to him. Okay, cool. So now I go to this inner ear doctor, and in the meantime, I'm doing my research online. I find this community of people that have this inner ear issue. They're all raving about this doctor out of Louisiana. And so, but I'm here in Jacksonville. So I end up going to a local doctor, and he's like, yeah, you have it. You actually have it bilaterally. So I have it on both sides. Lucky me, right? And so he's like, here's what I'm going to recommend the surgical procedure. Now, after all my reading, I was like, I'm not really sure about that surgical procedure. So then I sought out this doctor in Louisiana who everybody raved about. And apparently, people from other countries have flown here to have him take care of them. So he's like, he was renowned with this particular um, uh, syndrome, I guess is what it would be. So he was renowned for this. So I reach out and I end up going and having a conversation with him, and we ended up having the surgery, and he did the surgery with what I thought would be the most appropriate, which he also agreed with, and he had actually much better reasoning for why he did, he agreed. So I tell you that story because a lot of people have had a less dramatic but similar story. You go to the doctor, you're complaining about one thing, the doctor dismisses you, they don't listen, whatever the case, right? But you're not getting the answers you're looking for. Or they believe you that you have these symptoms, but they get the wrong diagnosis. So they're like, all right, try this medication. You try the medication and that doesn't work, or they send you here. And so you end up cycling through, right? So it's not hard for people to believe that the third largest cause of death was medical errors because we've experienced them. We know people who have. So this is like this patients are not doctors. And but we observe the world around us and we make connections. And when we experience or know people who've experienced errors in the medical community, then to hear the third largest cause of death is medical errors sounds pretty reasonable. I'm like, yeah, I'm going to go with it. You're not going to question it. And you're further not going to question it when you see like the Washington Post, Time Magazine, John Hopkins, when you see all these, establishments reporting this, well, now you further are going to believe it because now all of these reputable places are, organizations, places that you feel like you can go to get information, correct information, they're reporting it too. Great. Now I'm walking away with this idea. Third largest cause of death is medical errors. So that's where it comes from. But I was still curious because, that's how I am. And so this person called out this dude's name and I was like, who is this dude? Uh, so I went digging a little bit, and here's what I found about her claim. So let's pull this up on the screen here. Let's see here. Yes, this is the one we want. And there. So this comes from Medscape. This is an article from 2019. I'm not going to read the whole thing, just the relevant parts to you. So here it says, uh, the supposed fact. So the title, just for anybody that's listening, no, medical errors are not the third leading cause of death. Oh, interesting. This was in 2019. The supposed fact that medical errors are the third leading cause of death in the United States has become a meme, spreading virally through society, from the scientific literature to the evening news. Okay, scientific literature. Isn't that what I'm supposed to trust, Dr. Love? As they're repeated within the scholarly community and popular media, estimates in the range of 200 to 400,000 deaths per year look like settled science. Totally agree. And any reasonable person that he would agree with this. That makes sense. You're hearing it from everywhere. But the methodology applied to arrive at these estimates, published in multiple scientific journals, multiple, falls short of the rigor needed for such an important topic. We are concerned that these estimates are inaccurate, implausible, and encourage unwarranted distrust in the healthcare system. Yet they have spread widely while critiques have not. Lowering our standards of scientific evidence, even for a good cause, sets a dangerous precedent. So I don't disagree with anything here. This all sounds exactly like I totally agree. If this is perpetuated out, people are going to be more skeptical about the medical community, right? They're going to be like, why wouldn't they be? Makes sense. So here we go. Popular estimates of medical harm have faced criticism since the National Academy of Medicine's seminal 1999 To Err is Human report, okay, which estimated the number of preventable medical error deaths at around 44,000 to 98,000 per year. So Now we've named another reputable entity, the National Academy of Medicine. Okay, so we still haven't found any articles that are like, yeah, it's totally this Marty Malarkey or whatever his name was. This guy's just running around for profit. And he's convincing everybody. We're not like he might be at the root, but again, this is perpetuated and people are getting their information from established sources. Two powerful critiques of this report were published in JAMA, that's the Journal of American Medical Association, which I'm going to be willing to bet that only nerds like myself will occasionally read when something interesting pops up. But as for regular Americans, they're probably not reading JAMA, and probably many doctors aren't reading it either. And I'm not just like you're busy, right? You're a doctor, you're doing doctoring, you're helping patients. You may not necessarily, by the time you get done from a long day at work, do you want to come home and just start reading journals? Maybe not. Probably want to come home, enjoy some time with your brand new golden retriever dog named Honey. Oh, no, that's me. But you might want to go home and enjoy the family. So I get it. But these counterpoints uh, in a top medical journal have only racked up a few hundred citations compared with the tens of thousands that the original report has achieved, according to Google Scholar. Now, whose fault is that? That's not my fault. I'm not to blame for that. It's not like I'm not the one out there, you know, saying, "Hey, citing only the good stuff, the stuff that I want to hear, but not the stuff that I don't want to hear." That's not me. And like, how did this happen? I don't think there's any one person to blame necessarily. Even a critique in the report by an author of the studies it was based on, published in the New England Journal of Medicine, has been cited in order of magnitude less than the report itself. So what they're telling us is that, hey, this initial report got a lot of attention. The counter argument, not so much. Okay, well, Dr. Love, is this really the fault of just some guy who wanted to make money? Sounds more like it just is the way things played out. The way things played out was the original story was juicy, got picked up by everybody, and then the counter argument, not nearly as interesting, didn't get picked up. Why? You'd have to dig in and see. Maybe the way it was presented, maybe any number of things. But it certainly isn't my fault, nor anybody else who is not a doctor, who's not a researcher, who is just casually reading when they can, as much as they can, right? When information pops up on their radar. It's not their fault either. Here's another one. This comes from McGill, Office for Science and Society. Medical error is not the third leading cause of death. An alarming statistic shared by countless people is based on a highly problematic bit of data extrapolation and has been used to paint all of medicine as untrustworthy. Okay, so we get down here. We're going to scroll down here. All right, so here's what this article says. This whole story has its prelude in a 2000 report called To Err is Human, Building a Safer Health System by the Institute of Medicine. The report took two studies, one done in Colorado and Utah, and the other in New York, and extrapolated their results to all hospital admissions in the United States, concluding that between 44,000 and 98,000 Americans must be dying each year as a result of medical errors. The lower estimate exceeded the eighth leading cause of death and trumped fatalities from motor vehicle accidents. Okay, so this was in 2000. In 2016, the British Medical Journal, so another yet established medical journal, published an analysis by a research fellow, Michael Daniel, and a professor who had developed the operating room checklist, Martin A. Macquarie. That's his name. Let's try to get his name right. So the original article came from 2000. And this Macquarie, who was blamed for just trying to make money, it was in 2016. Like, that's when he did his work, and him and another doctor put out their analysis. To call it a study would be inaccurate. It was a call for better reporting of medical errors, motivated by a lack of funding available to support quality and safety research and propped up by a back of the envelope calculation. The authors looked at a few of the studies that had been published on the problem since the Institute of Medicine report. They took the mean death rate from medical error from those studies and extrapolated them to the total number of U.S. hospital admissions in 2013. So they're basically saying, all right, here's these numbers here, here's these numbers here. What can we discern from this? What can we decipher? How do we get this? Like what does this tell us? What can we make an assumption on? After adding that, this extrapolation was surely an underestimation of the actual problem. They concluded that this would mean medical error would rank third in the Centers for Disease Control's list of causes of death in the United States. This became the title of their published analysis, which has been cited in at least 1,265 papers, according to Scopus. And this memorable idea spread to news articles, television shows, and alternative medicine circles. So it just got picked up and ran around, and that's what got its popularity. Now, here's interesting. Critics of this analysis have pointed out many flaws. It is based on studies whose data was never meant to be generalized to the entire U.S. hospitalized population. For example, one of these studies by the Office of the Inspector General of the U.S. Department of Health and Human Services was conducted in beneficiaries of Medicare who are aged 65 and older, have disabilities, or have end stage renal disease, which requires dialysis or transplant. Okay, so what is all of that saying there? What it's saying is that some of this information, so when you had these studies done, and then you have these two doctors come and they say, wow, this is interesting studies. What can we learn from this? And I think we have a problem with medical errors. And so then they use that information to extrapolate and say, okay, I think if we were to take this and this is, if this is representative of the whole, then that means the whole is this. That's where it's claiming they made their mistake. Now, I didn't dig into the actual numbers, so I'm not going to say that they necessarily were wrong or right, but it does sound like that way. It sounds that way because if you take a population and part of your study includes people that are only 65 and older and happen to have certain health issues already, then they're not representative of the greater pop. They're not representative of me going to the doctor saying, I think I have this weird ear issue. Okay. That's not representative. So the medical errors that I have are going to be different than the medical errors that these people had because they're already in bad shape. And so the medical errors may affect them with a greater intensity than they will me. It might just cause me some money and some frustration, but it might not cause me to die. As you can see, I'm right here, still here. Okay. So that's what it's telling us. And so I thought, like, that's very interesting between books written by doctors about doctors not listening, medical errors, and and regarding medical errors, and the sheer number of times medical errors uh, being the third leading cause of death was reported. Is it really any wonder that somebody like me, who tries to get things right, who really digs into the information, took it at face value and said it must be true? Like, this doctor is off her rocker if she thinks I'm just being a dummy. Like, there's no in this particular case, I had to specifically go out and look this information up because as we saw, it's not being promoted by the same mainstream media that promoted the first narrative. So I had to, like, what would cause me to go digging further? Well, in this particular case, the fact that she mentioned somebody's name caught my attention, but barely. If she hadn't mentioned the name, if she'd have been like, yeah, that was debunked, whatever, you're just an idiot and just move. I mean, she didn't say anything like that, but if she had said something like that, I would have been like, whatever, just another dumb doctor, thinking that their PhD means something. And then to some degree, it's true, right? Like, because she didn't really try to correct me. She just tried to dunk on me, right? Well, here we are. I'm dunking on you now, doctor. All right. So, what does COVID have to do with any of this? Well, we'll get to that in a second. Let's get some comments here. Let's see here. Do. Keith Garrett says, our lab folks take a medical errors session every year, but they ask certain questions. Why they ask certain questions, I believe. What's your name? Why are you here? So on and so forth. So that's interesting, right? Like, there should be medical errors sessions because that's important. This is the reason. So, like going back to that story, when I had my surgery, the doctor who I went in to see and he knew me by face and I knew him. I'm prepped. I'm ready for surgery. He comes in and he says, "Hi, Dan RDL. We're going to operate on your right ear today. Correct?" Yes. Right. He confirmed it with me. Then he comes over and he literally writes on my ear with a pen, like a little Sharpie or something like that. And he's like, and he said something I can't remember exactly what he said, but it was something along the lines of like, I like to sign where I'm working or something like that. But what he was really saying was like, we're confirming the work that we're doing so we don't cut into the wrong ear. Right. That's what he was doing. He was doing that to make sure there wasn't a medical error, because this has happened. We've seen stories where somebody goes in, the more dramatic ones are somebody goes in and they're like, they're supposed to have something simple done, like, I don't know, have their appendix removed, and then they have like a leg removed. Those are like those are very few and far between, but they do happen very rarely. But we've seen those stories where somebody has went in for one thing and they had like an entire leg removed or something crazy. More likely you see things like maybe a doctor left an instrument inside somebody, those kind of things. Those are still pretty dramatic. But, so these, there are errors that happen, and they happen from you get the wrong diagnosis to the doctor leaves a tool inside of you. This happens. And why? Because doctors are human. That's why they make mistakes. But all this leads to a lot of skepticism on part of everyday people, because that's what we experience. So let's get into what COVID has to do with any of this. Now, you might remember when people were skeptical of counting COVID deaths. It was a question of, did people die of COVID versus from COVID? And like there were memes and jokes about it. Like people would say like, oh yeah, they got in a car accident and died. Did they have COVID? That they died of COVID. Like those were the kind of conversations that we were having. So this comes from the Association of American Medical Colleges on that topic. So let's pull that up and let's see. Was I able to highlight? Yeah, I was able to highlight this one. So this is titled, "How Are COVID-19 Deaths Counted? It's Complicated." And this is from 2021. Let me put that up on the screen for you guys so that you can see it. All right, so here we are. So I'm going to scroll down. We're not going to read the whole article. If you want to read it, it's in the show notes. Here's what it says. Early in the pandemic, some of the answers, that was big. Some of the answers provided by public officials who were scrambling to track the disease as it overwhelmed health systems fed skepticism. Last April, Deborah Birx, MD coordinator of the White House Coronavirus Task Force, said this when people asked who have COVID-19 but die from pre-existing conditions. Here's what she said. If someone dies with COVID-19, we are counting that as a COVID-19 death. This statement, combined with some state health officials saying they follow the same policy, sparked charges that the COVID-19 totals were inflated by deaths from other diseases and even auto accidents. Okay, this is coming from the Association of American Medical Colleges. This isn't, again, some podcast bro who's just making stuff up. This is coming from a reputable source that people were making these claims, which they were, based on if someone dies from COVID-19 with COVID-19, we're counting that. So then it goes on to say, if the victims happen to have COVID-19, federal and state governments gradually altered such policies over the spring and summer to say that in order for a death to be counted as COVID-19 death, the disease had to have played a role. Oh, okay. So now we're acknowledging that our own governments, federal and state, changed how they were counting COVID-19 deaths based on the skepticism, based on the comment that Deborah Birx made, that if somebody dies with COVID-19, we're counting that as a COVID-19 death. So they literally changed their process. Continuing on, it says there's no evidence of orchestrated inflation, but parsing the role that the disease plays in some deaths is not always easy for doctors, nor is the process clear to the public. That is very important. I am the public. I am not a doctor. I've never been to medical school. I read things as I need, as things pop up that I want to talk about, but I don't know the processes that are involved. I only know what is being said and communicated out to me. So if you tell me, hey, we're going to count these deaths. If you died with COVID, we're counting it as a COVID-19 deaths. Yeah, I'm probably going to be like, okay, well, then that must mean that you're overcounting deaths. Very reasonable response. Nothing wrong with that. All right. So then let's go back to Dr. Leanna Wen. And for some reason, it wasn't letting me highlight this. So I got to try to find out where it was. This is because I'm on, it's the Washington Post, and I couldn't read the old article without having a subscription. So I'm trying to read it from the Wayback Machine. So, okay, here's what I wanted to read. So this is an article titled, let me just do that there. This is an article titled, this is in 2023, we are overcounting COVID deaths and hospitalizations. That's a problem. Okay. So again, she's not a right winger. She was advocating that we all be locked down. Okay. She was a bit crazy in my opinion. So here's what she says. Another infectious disease physician, Shira Doran, has been researching how to more accurately attribute severe illness due to COVID. After evaluating medical records of COVID patients, she and her colleagues found that the use of the steroid dexamethasone, a standard treatment for COVID patients with low oxygen levels, was a good proxy measure for hospitalizations due to the coronavirus. If someone who tested positive didn't receive dexamethasone during their inpatient stay, they were probably in the hospital for a different cause. Then it goes on. Doran's work was instrumental to Massachusetts changing its hospitalization reporting a year ago to include both total hospitalizations with COVID and those that received dexamethasone. In recent months, only about 30% of total hospitalizations with COVID were primarily attributed to the virus. What are we saying here? What she's telling us is that, yes, they were overcounting them, but the the information here suggests that it wasn't to make it sound scarier or for any nefarious reasons. It was just simply like, and if you read through these articles that I've found, they will tell you that there are just challenges because, like, okay, if a healthy person like me, I'm otherwise healthy, I don't have high blood pressure, I don't have diabetes, I don't have any of these other things. If I come in and I've got the symptoms of COVID and then I pass away, then yes, COVID was probably the cause of that. But if I come in and I've got cancer and I'm going through chemotherapy, which means my immune system is already shot to hell, if I come in and I've got COVID, then yeah, COVID may have been what brought me in because I was already in a weakened state. But then the question is, did you really die from COVID or did you just die from because you were in a weakened state and the flu might have also killed you? Right? Like in parsing this out is difficult. And so then they had to try to figure out, all right, how do we count these so that we have the most accurate number? So that when we go look back at the data, we don't say, yeah, that really shouldn't have been counted and that one should have been counted, right? This is a process. And I'm okay with this because like they said, COVID was relatively novel. We didn't, and it hit hard. A lot of people got it. So then the real question was, to what degree is it causing people to die? Right. And it's easy if somebody doesn't have any kind of pre-existing conditions. If somebody doesn't have those and they die of having COVID, pretty easy. Right. It's also pretty easy if somebody gets into a big car wreck and they get smashed up, even though they might have had COVID, that's not what did it. Right. But then there's the things in between that make it a little bit more challenging. And so then they have to figure out, like, all right, how do we determine that, yes, COVID was the primary problem? That was what that's really what got you. It wasn't the fact that you were already half dead in the first place. And so I'm comfortable with them saying that we need to, but here's the thing. While medical errors appear to not be the third leading cause of death and never were, the medical community still retains their hubris. When medical doctors promote it, when the mainstream outlets promote it, from all political partisan sides. When medical journals promote it, what are people supposed to believe? Then you scroll forward and you say, wow, we had certain numbers coming out and a certain way of identifying COVID deaths. But then even that got challenged and they made some changes so that they could more accurately report it, right? What does that say? That says that there are mistakes that are made or there's a learning process that needs to happen. So then you come back to us regular folks. Yes, Dr. Love, if you're going to engage with people online and you want them to know the truth, then you do have to exercise an extreme level of patience, especially when your own community is responsible for the messaging. I got the message from your community. It wasn't from the McCary guy. I didn't even know his name until I saw it. And it just so happened that it initiated some curiosity out of me. So therefore I went digging. But I can tell you many people aren't that many people aren't that motivated, especially when they're like, I saw it on all these establishments. Why should I bother challenging it? You know, if you saw NPR, PBS, Time Magazine, Washington Post, uh, the BMJ, the British Medical Journal, the John Hopkins University, the National Institute of Medicine, I believe it was. If you saw those organizations telling you the third leading cause of death was medical errors, and then some doctor sharply says, "I don't have to explain this to you. It's been debunked." Yeah, I'm going to think you're an idiot. That's just how it works. Because you're literally asking, I don't even know you. I've never even met you in person. I don't know if you're a smart doctor or you're a dumb doctor. Look, we all know that they exist, right? Every profession has their smart ones and their dumb ones. I don't know if you're a good doctor, if you're a bad doctor. I don't know if you've got, some agenda behind. I don't know anything about you. And you want me to just basically take your word that it's been debunked multiple times over all of these established organizations that have told me this for years. For years. And that's, and books have been written about it. Other doctors who I don't even like have talked about it, but in a convincing manner, right? But I'm supposed to believe you. I'm the bad guy because I don't believe you. No, that's hubris. And that is a you problem. And by the way, let's be clear. This doctor, she wasn't even accurate anyway. Because number one, I didn't know the name Marty McCary, so that was wrong. She just made an assumption that I was promoting it because he said it. Never heard of him. Now, there's no way for me to prove that, but take me at my word, considering all the evidence that I put together today. Seems like there's no reason for me to lie. Um, Many established organizations are responsible for promoting this, right? They circulated it, so I got my information from them. So I didn't get it necessarily from him. I got it from established places. And then it's actually unclear to what extent that he is actually responsible for its current perpetuation, considering that he does not single-handedly control the counter narrative any more than he did the original one. Like he might have put it out there and then it got picked up and just went viral. That's not a him problem. That's and this happened with vaccines. I don't want to get too deep into it, but this happened with vaccines regarding autism. Remember the author? If you go back and you do the research, the author that published a study that linked vaccines with autism, and then that paper has since been withdrawn and retracted. Like he published the paper, but then all of these outlets ran with it. They did, not him, them. So you might blame this guy and say, "Hey, he did shoddy work," and that's one argument to have. But he wasn't responsible for the widespread circulation of it because he didn't control the news outlets. He didn't control any of the journals that published it. He didn't control any of the doctors that read it and agreed with it and maybe didn't do their own investigation or whatever, right? He's not responsible for any of that any more than Marty McCary was responsible for all these organizations running and saying third leading cause of death, medical errors. She is a PhD and she got bested by some random podcast guy who simply reads. That's hubris on her part. And so when the medical community wants to cry and say, well, why don't people trust us? Right here, send them this episode. This, because we could go on for hours and talk about other examples along the same line where information has been communicated to the general population from reputable sources, or there have been mistakes made. We go in, we try to tell the doctor what's going on. They're interrupting us. Like, that's actually true. Like, virtually everybody will attest to that. Whether or not it's actually 10 seconds, that's arguable. It depends on how they gathered that information. But we all know that doctors interrupt us. We all know that we're trying to tell our story and doctors aren't listening quite regularly, or they give us crappy answers like, hey, I'm hearing things in my ear, my body sounds, and it's distracting. And I think it could be causing other problems with my cognition. And then the answer is, yeah, just turn the radio up. Oh, okay. That's not distracting whatsoever. Just turn it up really loud. And then I'll be able to, read a book because, when I'm reading and my eyes are moving, I won't be distracted now from the sounds in my head. I'll be distracted by the sounds outside of my head. Thank you so much, doctor. Those are the kind of things that cause mistrust. And I think this is kind of natural. Like, it's just the way that things play out because you simply have all these different entities at play. That's what's going on. Like, I don't think there's anything nefarious. You know, you just doctors are busy. They got a lot of patients. Patients come in. We're not very good at describing things. We walk in, we're like, my stomach hurts. What does that even mean? You're like, do you feel nauseous? Do you have gas? Do you have indigestion? Where in your stomach? Maybe it's not really your stomach. Maybe it's somewhere else in your abdomen. You're just claiming it's your stomach, right? Like, these are the kind, like, miscommunication, I think, is really the result of it, which means the people who are in the know, the people who are responsible for giving us the final word, I think the onus is on them to make sure that they keep that line of communication running smoothly. Because I'm the patient. I'm just going to come in and just tell you, and be like, my head hurts. And then you're going to have to try to figure out, does he have a headache? Did he bump his head? Has he got a sharp pain that's not supposed to be there, that's being caused by, a pinched nerve or something, like whatever. Like, that's the doctor's job. So they have to lead that conversation. And if you're going to get online and you're going to try to dispute something, then you should at least have the humility to be like, yeah, it was my community that and the media who really perpetuated this. And maybe this guy did shoddy work. And here, Mr. Liberty Dad online, who's challenging this and perpetuating it, here's some information that you may not be aware of because it simply did not get the same traction. And I think you'll find it interesting. And all it takes, like, in that exchange, she could have said, hey, you're repeating a mistruth. I encourage you to read this article. And then she could have, like, she wouldn't even need to follow up with a tweet, right? Well, let's look at it real quick. Let's just see what she could have done. All right. So here we are. Here's the first one. Right. Let me turn that music off. Boom. There we go. All right. So let's turn the music off. So he says, I can't believe people fall for this crap. And so then I chime in and I say something about, hey, good point. Third leading cause of death. Right. That's my initial statement. Right here, she could have ended the conversation. Instead of saying, oh, you're repeating Marty McCary's lie, she could have said, ah, you have been, this has been miscommunicated to you. You have been, new information has come out. That's what she could have said. Hey, new information has come out. You may not be aware because it didn't get nearly the amount of traction. Here's a good source for you to check out. You'll probably be interested in that. Conversation over. She didn't have to come back after that. I could have said whatever at this point, right? I could have been like, oh, you're stupid, blah, blah, blah. I wouldn't have said that, but I could have. I could have said something along that line. And she could have been like, hey, I did my duty. I helped this guy out. If he don't want to read, you can lead a horse to the water, but you can't force him to drink. And that's what she did. But she didn't, right? And so then I fire back, and then she fires back, right? And guess what? At no point did she offer me any evidence or information to support her position. Nope. She just says, nah, I don't need to be patient about correcting it. All right. Well, guess what? Now you don't get any credit for correcting it. I get it because I did the work. You get none. Like, like I had to go and research it. I had to go and use my Google foo. And you didn't point me in the direction of something. I can't go, man, I'm glad that this doctor here came out and said, informed me something that I wasn't aware of. Nope, you don't get that credit. All from me, not giving you any, not even for the fact that you initiated it by using the guy's name, because it was just happenstance that I happened to be curious. It was my curiosity that led me to this conclusion. So, third leading cause of death doesn't appear to be medical errors, but medical hubris still alive and well and kicking. All right, folks. Let's see. Any other comments that I got in? I agree. I agree with this. That Liberty lady says, you're not just some random podcast guy. You're Liberty Dad. And that is true. I'm pretty important. You know, if you know the reference, I'll leave you with this. I'm big in Japan. All right. Thank you for watching. Hope you found this episode informative and inspiring. Be sure to catch me Monday through Friday, 7:30 a.m. for an informed discussion on politics and culture. By the way, I'm always looking for dads to join me for Dad Talk. Dad Talk is my series where I invite everyday dads on to talk about what's important to them in the context of being a dad. No argument, no debate, and dads choose the topic. It's my way of raising dad voices. By the way, this Friday, I've got a local dad that's going to be on the show, not in person. He is going to be we're going to be, remote, but he is coming on. I think you'll be excited about the topic. I'm excited, so look forward to that. I've already got it settled. We're doing it, so it's really cool because like this will be one of the very few dads that here's here in Jacksonville that I've been able to interview and that I know in person, and is providing a benefit to my family, which you'll find out on Friday. Make sure that you're subscribed to my YouTube channel or my Rumble channel. You can go to youtube.libertydad.com or you can go to rumble.libertydad.com. While you're there, let me know how I'm doing by leaving me a comment. Last but not least, I want you to remember, if you're a champion of liberty, your business is people and your product is liberty. I want you to have a great week. Catch you next time. But for now, I'm out.